Hi, I'm Michelle.
Hi, I'm Dan.
And today we're going to be talking about the Bachelor of Podiatry with Honours course. We're going to be discussing what is a podiatrist and what sort of employment opportunities are available to you.
And we'll also talk about the study requirements that allow you to become qualified as a podiatrist.
Okay, so first of all, what is a podiatrist? So a podiatrist is a healthcare practitioner who's highly skilled in the assessment, diagnosis and treatment of people with foot problems. We see all types of people from young and old presenting with lots of different foot problems. So we see people who are well, but then also people who have skin and nail problems, musculoskeletal issues, or who might need minor surgical treatments. We also perform biomechanical assessments and gait assessments for patients who have sport injuries. So people with specific medical conditions that affect the foot, so people with diabetes as an example who have foot ulcers, we work with them to try and avoid them having an amputation. So we're involved in lots and lots of different areas. To be a podiatrist, I think some of the key attributes are to be caring, empathetic, enjoy working closely with people and have really good communication skills. In my opinion, I think podiatry is the best kept secret in health. And the reason for that is that it sets up great career opportunities for you to become a foot and ankle and lower limb expert, working in lots of different specialty areas such as sports podiatry, conducting minor surgical procedures, working in pediatrics and the high-risk foot. There's great opportunities for employment and you can work in lots of different areas such as hospitals, community health and private practice.
The Bachelor of Podiatry with Honours is a 4-year course. In Year 1, our students will complete core content such as anatomy, physiology, introduction to clinical practice, and medical microbiology. In Year 2, we advance our theory by looking at foot and lower limb anatomy, pathophysiology, pharmacology, indigenous health, gerontology, and paediatrics, just to name a few. In Years 1 and 2, our students also get exposed to clinical practice for the first time, and as they work their way through the course, the complexity of that clinical practice builds to match their skill set. By 3rd year, our students are ready for external placement, so they'll start going on placements in private practice, in the public sector, such as hospital settings and also in community health, while still building their knowledge around podiatry theory with topics such as foot and ankle surgery, paediatrics, musculoskeletal injury, biomechanics, orthotic management, pharmacology. In the last 2 years, our students also pick a stream of honours. It might be a industry honours, which makes them really work ready, depending on the project that they pick, or they may choose a research stream that prepares them for either life as a researcher, or it may simply be a little taster for them to advance their research skills. At La Trobe, we pride ourselves on having job-ready podiatry graduates. We can do this by having an on-site podiatry clinic that has 17 consultation rooms, 2 paediatric suites, and a surgical theatre. In addition, we have a fully functioning orthotic laboratory where our students can learn how to prescribe and manufacture foot orthoses.
Our students get great clinical exposure by going on external placements in hospitals, community health centres, and in private practice. They also can travel overseas and participate in podiatry exchange programs and placements abroad. Here's a little bit about what your career in podiatry might look like.
Podiatry is more than just the foot, it's how the foot interacts with the lower limb and the rest of the body.
Podiatry is really important because the foot has a really important role in terms of maintaining mobility. So you simply can't perform at the same level if you've got foot pain.
Podiatrists play a really important role in healthcare. Patients often come in with a complex medical condition, so you may need to communicate with their GP, their dietitian, the rheumatologist, and you need to work together in order to get the best outcomes for your patients.
The part that I enjoy most about teaching is sharing the knowledge that I've picked up throughout my career. If I can share some of my experiences with students, I feel like I can fast track them on their journey to being the best podiatrist they can be.
Here at La Trobe, we have an on-site health clinic. We get to work hand in hand with patients with real conditions. We take these skills to our clinical placements, which take place in hospitals, community health centres and private practices, and we're supported by a great academic team.
Early on in the degree, students get exposed to patients so that they can start fine-tuning their clinical skills early on.
We'll also get to work in small groups in workshops under the tutorage of some very experienced facilitators and podiatrists, which I think altogether lends itself to a well-rounded and dynamic learning experience.
It's an upcoming field. The demand is so high for podiatrists. The diversity is so vast. There's so many opportunities that you can go into.
A podiatry degree at La Trobe opens up a lot of opportunities. Not only does it let you qualify to practice as a clinical podiatrist, but it also opens up opportunities for business, for industry collaboration, and also for research.
To me, podiatry is the best kept secret in medicine. There's not many jobs that combine general medicine, dermatology, rheumatology, neurology, endocrinology and surgery in one day of work.
The prospects for our graduates are really strong. Anyone who graduates with a degree in podiatry has got a very bright future. We've got a growing profession, we're well respected in the health sector, and most importantly, we can have a major impact on the quality of our patients' lives.